Now, shifting focus to COVID updates, amid the rising COVID cases in the country, the Serum Institute of India has urged the centre to use the available 10 crore doses of Covishield offered free of cost under Covax facility. The Pune-based firm has written to the Ministry of Health that if these 10 crore free doses of Covishield are not taken by the Indian government timely, it will lead to a wastage of the life-saving vaccines amid uptick in COVID cases. According to sources, SII has already supplied 14 crore doses of Covishield to the government through UNICEF under Covax facility of Gavi free of cost. Apart from these, it has also offered 10 crore doses of Covishield free of cost. And for more details, in fact, to discuss this issue further, I'm joined by Dr. Suneela Garg, who's a member of the Lancet Commission and also a COVID India Task Force. Thank you, Doctor, so much for speaking to Mirror. Now, what's your response to this request by Serum Institute that we, of course, know is manufacturing Covishield, also considering that there is an uptick in cases in a few metro cities like Delhi, Chennai and Mumbai, and also now that there are so many doses, at least 14 crore doses that are still unused, which SII has requested the government to make use of, considering the government is also looking at increasing the booster dose in our country. Do you think these doses can be used to, divert these to for the booster dose drive in our country?
Thank you so much. I think it's a very, very important question and which is in everybody's mind. But what I like to bring at this juncture is that India has already got, 95% of the population who has received one dose and 83%, more than 83% who have received 2 doses of the vaccine. So at this point of time, also we have started with the booster or so-called precautionary doses as well. But it's a question of, we have to see that, we do have adequate amount of natural immunity as well. From Covax perspective, it will also be very important that whatever doses what India can use, that is very important. But at the same time, it will be important to give the vaccine under Covax facility to those countries as well, which are having very, very lesser coverage of vaccine, particularly when we talk of Southeast Asian region or we talk of African region. So this will be very important from that perspective. Though it's a very nice gesture, and we have to see that right now we have done 187.6 crore vaccinations, but it is also important to look at the pace of vaccination, whether we will be able to utilize that or we will not be able to utilize that. Considering the present pace of vaccination, it is important that we either, however pace of vaccination is increased, we will not be able to do that much, of vaccination in the coming time. So it will be very important that under Covax facility, we do share the vaccines with our neighboring countries also and African countries also, because if everyone is protected, we are protected. Because today we talk of one world, one health. So it is important that basically everybody should be given a chance, so that they can immunize their population in their own countries.
Right, ma'am. If I've understood this correctly, so Covax is basically, it's an initiative under which all the countries, especially that come under that Covax initiative, they are eligible to get these doses. And if I've understood this correctly, at least 14 crore doses have been particularly reserved for the country of India. So in that sense, I'd like to know from you if the center of the Indian government can divert these doses to other countries, supply these very same doses that are reserved for India to other countries in order to boost the immunity level of other poor and backward countries.
See, we cannot let the vaccine go waste. So in all probabilities, the vaccine definitely can be diverted, because if you remember in earlier times also, when we had the vaccine, but we thought, I'm talking of the initial stages, at that point of time also it was discussed that, why Indian government has diverted the vaccine to other countries, right? So it is important that we will definitely, though there are 14 crore doses, if we are able to utilize, that's well and good. But looking at the communication perspective, looking at the, uptake of the vaccination, I think it is very, very important to have a dialogue, dialogue with WHO also, to basically look at that how much, vaccine can be diverted to other countries. As I said, that basically if we are going to be, protected only when others are protected. So definitely a dialogue at this stage definitely is very much essential, so as to, not let the vaccine go waste and utilize the vaccine for other countries as well. And we have to also look at what is the expiry date, which is nearing very soon. So we cannot let the vaccine, we should not let the vaccine go waste.
All right. Thank you so much, Dr. Garg, for sparing your time and speaking to us and sharing your perspective on this important issue of Covishield doses that right now are lying unutilized. And if not used in a timely manner, they will unfortunately, at least 14 crore doses, unfortunately, will go waste. Thank you so much for joining us on that.